Hi, we're going to be measuring range of motion today for the index finger. For all of our measurements, it's best if you have the patient seated in a chair with their arm resting on a table. Hand position will vary based on the different movements. We'll go ahead and show you that for each individual measurement. We've got two different type of goniometers here that you can use. One is an 8-inch goniometer that has the straight edges, not the big round one. And the other goniometer we're going to use is a finger goniometer. So now we'll show you the individual movements for each measurement.
Metacarpal phalangeal abduction. The bony landmarks are the dorsal midline of the metacarpal, the dorsum of the MCP joint, and the dorsal midline of the proximal phalanx.
So first you want to start by instructing the patient where they need to move their finger. So when I ask you to, I want you to move your finger out to the side like this. Okay? And then you take the goniometer and you line it up, the axis on the MCP joint, the base on the metacarpal, and the moving arm along the proximal phalanx. Okay, go ahead and move your finger. So here you can see this is along the line of the metacarpal. We're still on the dorsal phalanx, and this is along the MCP joint, and this is along the proximal phalanx. And the measurement there is approximately 12 degrees.
Metacarpal phalangeal adduction. The bony landmarks are the dorsal midline of the metacarpal, the dorsum of the MCP joint, and the dorsal midline of the proximal phalanx.
Okay, so when I ask you to, I want you to move your finger in this direction. You're going to set up the goniometer similarly to how you set it up the first time. The base is going to be along the metacarpal dorsal midline. The axis will be on the MCP joint. And the moving arm will be along the dorsal midline of the proximal phalanx. Okay, go ahead and move your hand. You're going to lock the goniometer into place. And you can see that you got approximately 30 degrees of adduction. It's recording for real. Okay, metacarpal phalangeal flexion. The bony landmarks are the dorsal midline of the metacarpal, the dorsum of the MCP joint, and the dorsal midline of the proximal phalanx.
Okay, so we'll be introducing a new goniometer. This one will be used to measure the flexion and hyperextension of the index finger. So first you ask the patient to position their hand in a cup-like motion and give them an example. You'll be placing the goniometer with the base of it along the dorsal side of the metacarpal. And then you just passively move their finger to make sure you're positioning the goniometer correctly, and then have them bring their finger back up, and then ask them to move the fingers by themselves. So go ahead and flex your finger for me. Okay, so it's measured at about 88. So from there you ask them to bring their finger up and bring it up as high as you possibly can. So that's as high as the patient can move it, so you lock it in there, and that is about 18 degrees. So their range of motion is from -18 to 88 degrees. Proximal interphalangeal flexion and extension. The bony landmarks are the dorsal midline of the proximal phalanx, the dorsum of the PIP joint, and the dorsal midline of the middle phalanx.
We'll be using this finger goniometer to measure the ROM of the proximal interphalangeal range of motion. So I'm going to ask the patient to cup their hand in this like position. And the motion we'll be using is you're going to bend your finger as such. Okay. So line the goniometer up. Could you bend your finger for me, please? Okay. We're starting at 0 degrees. Could you bend your finger for me, please? (84 degrees). So that the range of motion is 0 to 84 degrees. Flexion extension.
Distal interphalangeal flexion and extension. The bony landmarks are the dorsal midline of the middle phalanx, the dorsum of the distal interphalangeal joint, and the dorsal midline of the proximal phalanx.
We'll be using this finger goniometer. All right, so the movement I'm gonna have you do is I will be stabilizing your finger, and I want you to bend your finger here, okay?
Okay.
So gonna line the goniometer up while stabilizing her finger. And we'll be starting at 0 degrees. Bend your finger for me, please. The range of motion is 0 to 26 degrees.